Good evening. My name is Mark Barnico, and I'm the Executive Director of the University of Chicago Francis and Rose Yuan campus in Hong Kong, our premier location in Asia, representing UChicago values of free and open discourse, rigorous debate, and the exchange of ideas. We're sharing tonight's event live via Zoom, Facebook, and YouTube. So if audience members have questions to submit, you can do so through first pressing the questions and answer button and first registering on Zoom. I also encourage you to visit our website at www.uchicago.hk and subscribe to our e-news for the latest news and information. Or you can also follow us on our UChicago UN campus social media accounts on Facebook, Instagram, and Twitter. We'll wrap up tonight's program with a poll, so be sure to stay with us until the end. Tonight we continue our COVID Life series and discuss defeating COVID through the use of big data and unique government policy approaches. Big data plays an important role in the policymaking process as countries attempt to contain COVID. Many countries are hoping the virus will just burn out, while mainland China and specifically Hong Kong currently are implementing a dynamic clearance or dynamic zero strategy. How different are these approaches to using big data to guide our government policy? Tonight we'll discuss how we can defeat COVID using different approaches and learn what's next for Hong Kong. Let's get started with brief introductions of our guest speakers tonight. Professor Marynia Kolak is the principal investigator of the Health, Regions, and Policy Lab, the Assistant Director of Health Informatics and Senior Lecturer in GI Science at the Center of Spatial Data Science at the University of Chicago. She co-leads the project, the US COVID-19 Atlas, which processes county-level data visualizations and analytics to better identify and track COVID hotspots on a daily basis. Professor Kolak is a health geographer and data scientist using open science tools and exploratory data analytic approach to investigate issues of equity across space and time. Her research centers on how place impacts health outcomes in different ways for different people, from opioid risk environments to chronic disease clusters. Mr. Hao Jia is the China subnational captain of the Oxford COVID-19 Government Response Tracker, otherwise referred to as OXCGRT, at Blavatnik School of Government, University of Oxford. OXCGRT has tracked various governments' different COVID policy responses since January 1st, 2020, covering more than 180 countries. Mr. Hao leads the data collection effort in China and documentation of the working paper, Chinese Provincial Government Responses to COVID-19. Mr. Hao is a dual master at the School of Public Policy and Management, Tsinghua University, and the School of Social Science, University of Geneva. Professor Benjamin Cowling is the division head of epidemiology and biostatistics at the School of Public Health, the University of Hong Kong. He's the co-director of the WHO Collaborating Center for Infectious Disease Epidemiology and Control at HKU SPH. Professor Cowling's primary research focus is in infectious disease epidemiology. He's designed and implemented large field studies of influenza transmission in the community and the effectiveness and impact of control measures. Welcome to all our panelists. Ben, let's have you start off the night by sharing the latest situation in Hong Kong and the strategy the Hong Kong government has adopted to try to fight the fifth wave.
Yeah, thank you very much. It's my pleasure to be here. In Hong Kong, unfortunately, we are dealing with a very major epidemic, primarily of Omicron, BA.2. Now, over the New Year period, we had the virus getting into our community a number of times after a period of more than 6 months where we didn't have a community outbreak. Over the New Year, we had Omicron BA.1 twice from aircrew in the community, and we had a Delta outbreak linked to hamsters, which that Delta outbreak is still going, but with numbers that are much smaller than the Omicron numbers. And then we had the final introduction was the Omicron BA.2. This is also called stealth Omicron in other parts of the world, and it hasn't actually been seen so much in other parts of the world. Typically, they have BA1, Omicron BA1 epidemics. The BA2 got into Hong Kong from a quarantine hotel transmission event and spread initially in a number of housing estates and then into the wider community. And we now have infections doubling probably every 3 days, but it's difficult to be precise about that. Case numbers are lagging behind infections and only capturing some, but not all infections as well. Case numbers are rising rapidly. Total until today in the fifth wave, I think, is 70,000 confirmed cases. Obviously, there'll be other confirmed cases. There'll be other cases that are not yet confirmed, but have been rapid test positive already. And there will be other people who are infected, would test positive if they were tested, but for some reason or other are not tested. So the number of infections up until today is far more than 70,000. My colleagues at the University of Hong Kong have done some simulation models of what might be going to happen. And they estimate that we will pass herd immunity within a couple of weeks' time in terms of the epidemic reaching a peak. And that's around the time we hit herd immunity under the control measures that are in place. Beyond that, later in March, the numbers will come down again. They'll come down through April to a low level by May. And at that point, a large fraction of the population would have been infected with Omicron BA2. Unfortunately, there's going to be an enormous number of infections. That means also consequent disruption on healthcare systems, healthcare provision, and the minority of infections that are severe will also be a minority of a large number of infections. And my colleagues forecast quite a substantial number of severe cases, unfortunately. In terms of mitigation, the government is doing a number of things to try to slow transmission down. Schools are online at the moment and they'll be closed very soon. A lot of people are working at home. There's a restriction in restaurants to 2 people. There's various other social distancing measures. There's a lot of testing being done. And that will slow down transmission, but it won't bring numbers back down to 0. The virus will continue to spread until it has a natural resolution of the epidemic. Now, if the control measures that we have in place now, the social distancing measures, were relaxed, the numbers of infections would be even more, and the transmission would be even faster. So the control measures are working in the sense that they're slowing down transmission, but the transmission is still going on, and there's still a lot of infections occurring every day. In terms of what might be going to happen in the future, I think that's unclear. The government have announced a number of potential policies, one of which is the mass testing exercise in March, perhaps, with the entire city being tested repeatedly. They're still fine-tuning. I think that the exact plan, the exact proposal, we'll have to see what happens. But that may be an opportunity for Hong Kong to get back down to 0 daily cases. That may be the objective. And if that were the case, the mass testing might help to accelerate that process. And then in the longer term, we'll have to see what the policy might be. I think there are options. One option would be to follow the Singaporean model and think about relaxing public health measures, because after a high vaccine coverage is achieved, there won't be so much threat of COVID. The other option is, of course, to go back to 0 COVID and try to establish a travel bubble with the mainland and try to keep COVID out of the community. So that's the current situation, and I can pass on to the next speaker or back to the host for what's next. Thank you.
Yeah, thanks, Ben. Thanks for your introduction of the situation in Hong Kong now. So yeah, I will introduce the situation in mainland China, and let me share my screen. Okay. Good morning and good evening, everyone. I'm Hao Jia, the China subnational team leader of OxyGRT project. And today I'm very glad to be here to share, to introduce my team and also our recent work on Chinese provincial government responses to COVID-19 with you. So first of all, let me introduce who we are and what we do. So my team is a global public policy tracker on government responses to the pandemic. So with the support of more than 1,000 volunteers, we have checked 24 policy indicators in more than 300 jurisdictions, including around 200 countries, as well as more than 100 subnational jurisdictions. So here is the indicator list in our database. We check the government's policies on closure and containment, economics, public health, as well as the vaccines. So under such a huge database and team, here is Team I lead, the China subnation team, which was convened in January 2021. So currently we have more than 90 volunteers from 23 universities, and they collected data from January 1st, 2020, and currently we have collected more than 700,000 data points so far. So here is the normal process of data collection. All our data were collected from publicly available sources, and all the data and most data were recorded on ordinal scales ranging from 1 to a higher level, which indicates the different level of policy stringency. And after we collected all this data, we will aggregate the individual indicators into various policy indices. So one of the most prominent one is the policy stringency index, which I will introduce later. And all our data are freely available on our project website. So let's move on to the working paper released in this January. So in this working paper, the core questions we want to answer is, how does mainland China cope with Delta and Omicron variants? What are the differences of response patterns along time in mainland China? And what are the key points to maintain its core strategy? So before we go into details of the government responses, let's have a review of the epidemic development in mainland China. So as you can see from this figure and table, the mainland China suffered from 5 main national waves from last year, and the last 4 involved Delta variants. The Omicron outbreak happened at the very beginning of this year, and you can see from the last row of this table, the 2nd, 4th, and 5th wave involved large-scale multi-province outbreaks. So let's have more detailed investigation when we look at the outbreak at provincial level, and here is a very interesting indicator we investigate is the average duration of outbreaks at provincial level in each national wave. So when we compare this number, we can see that the pandemic was better controlled in the second half of 2021 than before in mainland China, because when we calculate the average of this duration in wave 2, 3, and 4, the number is 10, which is lower than that in national wave 1. And as you can see in wave 5, the resurgence of the Delta variant in Xi'an, Shanxi province, and the introduction of the Omicron variant in Tianjin, Henan, and Shanghai caused an increased average duration. But this number is still lower than that of the first wave, the second wave, and the third wave. So we can conclude that the local transmission was still controlled effectively under the dynamic clearance strategy in mainland China. So since we mentioned this very popular name of strategy, so here I want to explain the meaning of this strategy. So according to the definition of National Health Committee of China, the dynamic clearance strategy has 2 main targets. The first target is to maximize early detection, early treatment, and early disposal following each local transmission episode. And the second goal is to halt the continuous spread of the epidemic at the community level. So given this consistent strategy in mainland China, when we look at the stringency index of policy we calculated based on our database, we could still investigate some minor change of the response patterns from last year. So as you can see in this figure, when we look at the light green line, according to the period of different national waves, we could divide this line into 5 stages. So the first stage is the widespread preventive measures in January 2021. So in this period, because the government needs to take some preventive measures before the mass population traveling in the spring festival season, so the government needs to take some preventive measures. And after this period, the stringency level gets reduced between March to June. So here is a relatively low baseline prevention and control period. And when the Delta variant introduced in last summer, here we can investigate abrupt increase of the stringency index of policy. So in this stage, we name it a reactive response in July to the Delta variant. So after the relief of this wave, we could investigate a relatively higher baseline prevention and control from last August to October. And in the very recent wave 4 and wave 5, although we can investigate another increase of the stringency level of the policy, but the peak value is lower than the value in last summer. So the reason is that many provinces governments take more targeted measures in November and December, and I will introduce this point later. So in this figure, we also added the situation of Hong Kong. So although the stringency of Hong Kong government get lower from the second half of last year, but with the introduction of Omicron wave, here is another increase of the stringency level of Hong Kong's government. So as I introduced, we want to explain the reason why some government could implement more targeted policies. So here, we investigate this phenomenon from the perspective of individual policies. So we selected 3 common policies to cope with the pandemic. The first one is the stay-at-home orders, and the green line illustrated the change of restrictions on internal movement, and the purple line shows the change of facial covering orders in mainland China. And we also divided these policies into 2 kinds. The dotted line represents the number of provinces with at least a soft version of a given policy, such as some suggestive policies. And the solid line shows the number of provinces with a more stringent version of the policy. So based on the change of these lines, we could conclude 2 main features of the individual policies in mainland China. And these 2 points is also the key points to maintain the dynamic clearance in mainland China. So the first point is that many provinces take fewer high-cost policies, and such as they maintain the cautious implementation of compulsory lockdown policies, and they implemented more suggestive stay-at-home orders. And the second very important point is that the precision of measures gets higher and higher along the time, because you can see there is an outstanding change of the green line, which means more provinces take more targeted restrictions on trans-provincial movement, and also some provinces take a more targeted lockdown of individual communities and buildings. And also another evidence of this point is that in many provinces, the government implemented more precise contact tracing technologies. So after we investigated this phenomenon, we want to explain that why some provinces could take more targeted measures. So here is a very specific case. We investigated the 20 provinces with local outbreaks in national wave 4, and we divided these provinces into 2 categories. In the first group, these 12 provinces in red are provinces with local outbreaks in wave 2, but in the other group, there are 8 other provinces without local outbreaks in wave 2. And when we control the severity of the pandemic in the national wave 4, which means the mean peak daily domestic cases is almost the same, around 13 positive cases each day, and we could investigate that the mean peak stringency index is higher in group B, and also when we investigate the mean days with stringency index higher than 60, the number is also higher in group B. So we can see that the provinces with experience in the first wave could implemented less stringent policies during the latter following waves. So this comparison might help us to explain why some provinces could implemented less stringent policies. So let's have a short conclusion of the content I'm sharing. So first, the local transmission is still under effective controls when we still maintain the dynamic clearance strategy in mainland China. And second point is that the keys to maintain this strategy is fewer high-cost policies and higher precision of measures. And third is that the trend is clear in the provinces with experience of several rounds of Delta outbreaks, and this trend is still continuous in Omicron outbreaks. So yeah, this is all the content I want sharing, and I will give the floor to Professor Marynia. Yeah.
Hey everybody, I will also use some slides. Let me share that. So I'll also be talking about some of the dynamics of big data policy in defeating COVID, but with a focus on the United States and the COVID Atlas specifically. So what is the COVID Atlas? You've already heard a little bit about that. Broadly speaking, the US COVID Atlas is a data visualization tool that provides quick access to current and historic COVID or COVID county level data, as well as SDOH data, which stands for the social determinants of health. So we provide access to data and spatial analysis in communities experiencing the pandemic. And in the US, as you can see now, that is all communities. Our mission is to understand, archive, and represent the often unequal impact of the pandemic across the US. We started back in March 2020, though had been tracking the pandemic since the start. And our goal was to address the lack of presentation of COVID data at a small scale resolution. So at that time, there was a big focus on COVID, how COVID was moving through countries or states in the US. But the actual scale of COVID is much smaller, as you know. So a hotspot has to be very mature and difficult to contain in order for it to emerge at a much larger scale. At that time, there was also a focus on cities, densely populated places, and that means highly resourced places. And that is actually problematic as, rural areas in places with less access to analysts and data scientists are at a disadvantage because there's just not the same access to understanding the pandemic at that scale. And this is despite a COVID outbreak anywhere being a threat to all people everywhere, right? If there is some way for people to interact, either just through proximity or through travel patterns, right? So we include near real-time data, and by near real-time, we use data that as of yesterday. So we include yesterday's data all the way to the very start of the pandemic. So it is a full spatiotemporal data set, and as you can imagine, that data set every day grows substantially. The project is led by our team at the Healthy Regions and Policies Lab at the Center for Spatial Data Science at UChicago. But since the start of the pandemic, it really emerged as a coalition across multiple institutions. And so as we've kind of matured through the pandemic, the players have changed. But for example, we have included team colleagues at the University of Wisconsin at Madison, at Berkeley, at County Health Rankings. And now we have a really robust community advisory board from institutions across the United States. So there's much uncertainty with this pandemic, not only because of the novelty of the coronavirus and the pandemic dynamics, but also because of the complex people part, right? So how different people are responding to this in different places, how policies are emerging, and so on and so forth. So while kind of traditional infectious disease specialists and EPIs at that level hone in on the mechanics of the spread, there remains an urgency in how to use what we do know with the data that we do have to inform decisions. So this is where spatial epidemiologists, health geographers, and public health informatics really comes into the foray, and that's what our team provides. So some core features of the Atlas include the ability to track regional hotspots in real time. We use the word hotspots very carefully. Oftentimes that can mean just about anything, but we use this, we have a very high bar for that term. We use statistical clusters using spatial analysis of both confirmed and daily new COVID cases and deaths with and without population adjustment. Again, it matters not just how many, like the count of cases, but also to capture areas disproportionately impacted, we also need to do that population adjustment. We facilitate watching COVID-19 spread through the country, and we use that with time slider and live time animation. And I can tell you that every kind of choice that goes into that, we've worked on that a lot, and it's been based off of feedback that we've been getting throughout the pandemic as well. You can also zoom in to focus down at the county level. And the key piece here is that you can, we live in uncertain times with uncertain understandings of what's happening. So we actually include multiple different data sources of the COVID pandemic. Just released a paper actually about the uncertainty of the pandemic, or pandemic data specifically, because not all data sources match. But we also compare, different spatial analytic insights and variables, so that there's an exploration and kind of uncovery process that emerges. And then finally, we can tap into community and health a health context, because COVID is not impacting all communities the same way. So here we connect to relevant social, economic, and health indicators to provide a meaningful community context. And we've been working on this for a bit, and we're still not done. So as the pandemic has changed, we've also adapted. Coming soon are customizable reports that might be useful, especially for community organizations. And we've also heard from journalists may be useful for uncovering concepts. We'll also be adding the ability to add, for users to add their own data in kind of a private and secure setting. And then we will also be adding oral histories that's already been launched, but that will come out next year. And that's because we found that in many cases, data is not enough. To really understand what's happening, we need to incorporate more stories, and also kind of to get that humanistic side of the data. So this is kind of a quick preview. If you'd like to explore the US COVID Atlas on your own, it's just uscovidatlas.org. But this is just an idea of what you see when you first load up the page. There's a lot of information here, but it's kind of hidden so that we're not overwhelming the user, because there's, again, so much to uncover. We can see the time slider at the top, a whole swath of variables to choose from. This also includes things like mobility measures at the county level that emerge from aggregated and pooled mobile data from individual data that has been aggregated up. So we use those sorts of variables to identify who was actually staying at home at a massive level, at a much larger level to protect privacy, and how that movement coincides with the COVID patterns that we see or don't see. We also include multiple date ranges, because how you slice data across time will impact the results, different geographies, data sources, and then multiple different ways of viewing the data itself. So you already saw that GIF earlier, that was the 3D map, but here we're looking at a traditional 2D map, and there's many other ways to view the data. And as you click on one of the counties, you get information that is either the tooltip is the most urgent data that we hear from our users, but also on the right-hand side of the panel, or a new panel emerges, and we get insights into quick trend statistics, some of that community contextual data, as I mentioned before. And so a lot of this is kind of coming into the topic of this session today, is really this idea that we need data to inform policy. We have to be really careful that it doesn't go the other way around, right? We don't want to start with what we're going to do without actually looking at the data. So I talked to my colleagues about, data informing policy with, the human kind of bureaucracies, interactions will happen in that arrow aspect of how it's communicated, but ideally we're capturing the truth of the data with the best knowledge that we have to inform that. We don't want to start with a preconceived idea and then just find data to support that, because data and statistics can be manipulated and have been manipulated. And that's not the kind of scientific standard that we want to hold ourselves to. And so I just wanted to highlight that, because that's also one of the themes of the Atlas, is just how can we find consistent trends that emerge over time, so that we're really sure even with all the uncertainty that exists. So we include multiple views of the data to achieve that. One of the insights we found, for example, is that with each wave of COVID, different communities were experiencing that. So there's not one wave for everyone. Like in here, the first wave that happened in the US was actually felt just by a very small, while everyone was experiencing quarantine, a few specific places were actually seeing the outbreak of that. And you can see here that not all communities have even experienced COVID yet. So that led to a lot of frustration by community members where they didn't necessarily understand why do I have to quarantine or stay at home if I haven't personally experienced that, right? So this kind of helps us understand human behavior collectively. The second peak also looks different. So it moves away from New England, and now we see it emerging more throughout the South and in parts of the West. And then here and this is all standardized, so we're looking at the same color scale throughout each of those. By the peak, well, this was the first peak. We've now actually gotten to another peak with Omicron. But back when this was taken a snapshot of in right before Omicron hit, you can see that this peak, you can really see COVID spread throughout the country. And this was, again, pre-Omicron. So this had very high rates of hospitalization and mortality, unfortunately. However, so for example, some of our users are really interested, and including us, are really interested in understanding communities that may be marginalized in the United States for a number of different historic and contemporary reasons. So we can also use things like, if we don't have actual data that's disaggregated at the county level of who's experiencing the pandemic differently, we can use other visualization techniques like dot density graphics. So that's what we see here. And then we also fold in information about resources like clinics and hospitals to help uncover stories. So here we're looking at vaccination data at an earlier stage in West Virginia. We see a few areas that have very, very low vaccination rates. I mean, pretty much zero at this stage, and in West Virginia, and we can start to, try to understand why, right? So there's many, many different reasons, but as we can see here, there's very few resources in some of these areas compared to others, not always, but in some cases. So this actually leads to a compounding crisis where if there is an outbreak there in the future, there may be fewer resources to access to quickly get people the help that they need. And we do know that access to health resources is really crucial to minimizing the worst COVID outcomes. And so kind of in conclusion, I wanted to highlight that how you visualize data really shapes your insights. Things like the spatial scale, how you actually classify your data and visualize it, what statistical tests you use, and even the color choices are going to change how we think about COVID and understand it and communicate about it. So here we have hotspots at the US in an earlier stage of the pandemic. Here it initially looked like in this first map, if you just look at things at the state level, you might just see that Illinois, for example, has a hotspot, and Louisiana at this time. However, if again, a hotspot has to be very mature in order for the whole state to be flagged as such. When we flip to a county level view, we can actually see that it's a very specific community in Illinois, the Chicago area, that's driving that hotspot, so that there is still opportunity for containment at that level. But we also missed some of the worst hotspots at the country at that time in the rural South, as well as on the west side of the US in the Apache and Navajo Nation communities. Those were averaged out when aggregated up to the state level, so those were critically missed. However, we also need to be careful when we're looking for patterns, because our minds are designed to detect patterns. Our brains are like neurologically designed to do that. So we need, again, math, statistical tests to confirm what we see. And so when we switch to a hotspot cluster, a statistical test, we can see that the clusters that we were hypothesizing are actually confirmed from that standpoint. And the reason, we need to look at data in multiple ways is because no single metric captures the pandemic experience or community vulnerability to that. That is both a point of criticism that I've heard, against the science community in the US, but it's also because there's just not enough information to know at this standpoint. No singular index is going to capture all of those pieces. Many have tried, but that's continues to be an area of debate in the literature. And that's because it just depends on the extent of the pandemic, what question you're asking, and so on and so forth. And because of all the uncertainty that I mentioned, we really need to look at multiple dimensions of the data. And finally, data guided policy in the US in very different ways, because there was a tremendous patchwork policy approach. You had different policies at national, state, county, city, even school and business levels, varying enforcement of policies. Some places had challenges of enforcement because there wasn't enough infrastructure or resources to implement that. Very different variation in access to quality information analysis. In kind of an extension of that is that there is a huge amount of misinformation about not only the pandemic, but needed interventions. And so I would say that it's, that's like misinformation is almost a larger threat than the pandemic in many cases in the US at this standpoint. And that's something that traditional analytics aren't necessarily built to address. So that's kind of an area of future need. And the graphic that you see here is just a snapshot of California and Arizona. California had a very strict stay-at-home policy early on in the pandemic, and Arizona did not. So what you actually saw over time was the traffic corridor between California and Arizona. We actually saw hotspots emerge along that traffic corridor. Why? Humans are humans. Their residents from California were probably visiting Arizona to access certain things. And there are several reports of that. So again, this is to highlight that, the spatial spillover of the pandemic doesn't necessarily, there are ways to that this creates different challenges. So at this standpoint, I'm going to pass things back to Mark to go through the next part.
Great, Marynia, thank you so much. That was really informative. Let's get the conversation started a bit here. I'm going to start with Ben because we had one question that came in specifically for you. And I'd like to kind of break the conversation a bit into parts on methods, sources, results, and policy. So the question that came in is from the Philippine Congress Committee on Health, and it was addressed to you, Ben. How do you evaluate the pros and cons of using mathematical mechanistic models versus statistical models when you're looking at this?
Well, so we know that with epidemic dynamics, if we try to just use statistical approaches, for example, fitting curves to data, it's difficult. We know very well epidemic dynamics will follow a pattern where infections spread as long as there's the potential, as long as there's people who are susceptible. And once that pool of susceptibles runs out, the epidemic will start to peak and then start to come down again the other side. So without a transmission model, it's very difficult to replicate disease dynamics. But then it depends on our research question. If we want to know what are the factors affecting severity, that's a statistical question. That the modeling comes in when we're trying to forecast epidemic dynamics or understand epidemic dynamics. And it's a really valuable tool. Of course, it's still a tool and it's not perfect, but having a dynamics in the equation is really, really, in my opinion, really important.
Great, I'm going to stay with you, Ben, because one thing that Marynia said that struck me, I thought was really interesting, is data informing policy versus policy informing data. And the question I have for you is, if we announce that we have a zero COVID or dynamic zero policy, are we putting the policy before the data? Or have we already done the work on putting the data together?
Well, no, I think if that's the ultimate aim, the ultimate policy objective is to keep cases at a low level, and if there are outbreaks, to get them under control as quickly as possible. It works very well in the mainland. We were doing well with the previous episode in Hong Kong. I think the data can be used to inform how to do that more effectively. And I'll give you one example, a concrete way that we can do that. When cases come into, when people travel into Hong Kong, they have to stay in a hotel for hotel quarantine. And a small number of those people, a small minority, will test positive for COVID. They'll be caught and identified in quarantine, and luckily they won't be able to spread infection into the community. One of the projects that we've done in collaboration with the Department of Health is the viral fingerprinting, the genetic fingerprinting of those cases that come into Hong Kong and are picked up in quarantine. And one of the things we found with the analysis of that sequence data, which is of course big data, is on a handful of occasions, there are 2 people in the same hotel at the same time who have identical virus. And they maybe weren't noticed before as being an occurrence of within hotel transmission, because there was someone who came in from America, someone who came in from Europe at the same time. They had COVID a few days later. What's the surprise? But when you fingerprint it and it's exactly the same virus, the odds are that it's been a within hotel transition. That happened maybe a couple of times that we know of. And there's also other reports, for example, that the BA2 wave right now. So that kind of data can inform the government that there is an issue with quarantine hotels. The risk is not exactly zero. And the BA2 epidemic that we have right now is the consequence of a quarantine hotel transmission, informing the policy that maybe we need a better way to do quarantine to sustain zero COVID, like they have in the mainland with the purpose-built facilities.
Great, thank you. I wanted to address your presentation where you talked about your sources being public sources. Are those reliable enough? And the second part of the question, and that will tie to my question for Marynia, is if you're using public sources, then you're not really using private data, individuals' data. Can you confirm that one way or the other, and then speak to the public sources that you're using?
Okay, it's a very interesting and important question, because if the source is not authorized, we cannot trust the findings we investigated. So based on my experience, I think the most policies implemented in China must be published by local governments, because we look at the provincial or lower level of government, and also in the guiding principle of central government of mainland China. It also gives much discretion to the provincial and county, even county level governments. And the publishment of these policies is not only to report to the higher level of government, but also to informing the citizens to cooperate with the government. So I think the local governments have enough motivations to publish all the policies they need to get informed of the citizens. For example, if the government want to take targeted lockdown of some communities, it must be published to all the citizens. If not, maybe some travelers from other city or province will go into these communities. So it's very important to publish all these policies in time. Yeah, that's my answer to your question.
There is a sensitivity in Hong Kong about privacy, data privacy. Can you assure with this dynamic clearance approach, dynamic zero approach, that people's privacy is protected?
Yeah, so yeah, the data privacy is another very important topic in the dynamic clearance strategy implementation. And as far as I know, in mainland China, we use mass contact tracing technologies, maybe linked to our mobile phones. But I know in Hong Kong, the main method may be self-reporting by the citizens. So I think that's a different way. In China, the privacy must be well protected. If not, I think the citizens want to agree with the government to do further epidemiological survey with their mobile phone. And I think in Hong Kong, I think it's a different way. Maybe it's more dependent on the cooperation with our citizens, because maybe it needs our citizens to self-report their past experience and visiting records to the government. So I think that's a different way, but the privacy must be well protected in all the process. Yeah.
Great, thank you. Marynia, can you speak to data privacy from a US perspective, and how do you mask individual data?
No, that's a great question. On some scale, there are kind of like some regions of the country might have things that are more based on some of the apps of individual contact tracing that were just mentioned. But as a whole, so a lot of the kind of main COVID data is communicated at regional scales. So that ends up being what is and that's because that's managed by the Center for Disease Control. Like the levels are always very high. So it actually has become a challenge to understand what's happening at the neighborhood level because of that, because the data is always reported at much bigger scales. On the flip side, a lot of technology firms like Google and so on and so forth, like every time you're using your phone, there is mobile tracking that companies are doing in exchange for you downloading their application, right? So that information that's at the individual level then gets repackaged and sold at much larger levels. So for example, we have like that's kind of the mobility data that I was talking about before. So at the county level, your privacy is protected, and that's why it's able to be shared and sold at that scale. But what was pretty exciting was at least during the beginning of the pandemic, there was a period where researchers and the private sector, everyone was interested in really kind of supporting whatever could be done to impact the pandemic. So that county level data ended up being freely shared for research purposes and for response purposes. So it ended up being really useful because even though there were policies that might have mandated stay at home, you can see from the data at a county level, at an aggregate level, that what parts of the country actually were staying at home versus not. So there are different levels of privacy, but it's interesting too that I think individuals are more willing to share their data with companies if it's kind of behind some walls than other groups. And I just want to note too that I think contact tracing of many parts of the country here now are not doing that at the same scale as before, because the numbers got so large that it became like the scale became very difficult. So I think that was for contact tracing to work, like that individual level is needed. And I guess that's kind of a warning of the US for the rest of the world, where that's not taken seriously, then things can definitely scale out of control.
Great, thank you. I'm going to spend a little bit more time with Ben because Ben has a hard stop at the bottom of the hour. So Ben, can we put the genie back in the bottle? Can we reach 0 COVID cases, number one? Number two, do we have to do this universal testing? And aren't there going to be further infections from people standing in line? Aren't there going to be issues with not being able to track the entire population of certain immigrant populations who we may not be able to reach? Can you just speak to our ability to do this here in Hong Kong?
Yeah, sure. So if it's okay, I'll just share one slide that I think can help to respond to that exact question. Just very briefly, though, obviously. What we have in Hong, what we heard a few days ago in the press conference from the chief executive is that the idea to do a mass testing exercise. Now, my colleagues at Hong Kong U have been projecting what might happen using mathematical models, and the curve, their latest prediction is shown here on this slide on the left, with a rising incidence coming to a peak in early March and then coming down again. Just with the current strategies, we know infections go up for a period of time and then they come down. And the peak of the epidemic is about the point where we reach herd immunity. If the effective reproductive number has been about 3, the herd immunity threshold can be estimated as a high fraction of the population actually. Not based on R0, but based on the level of control measures and the effective reproductive number. Now, if we were to do mass testing at the peak, we'd identify an enormous number of infections, and I don't really understand what would happen in that scenario, what those people would do. They could isolate at home, but it's a lot of work. And also, as you mentioned, there's the potential that doing the testing itself could actually somehow increase transmission in the short term, in the sense of people traveling and queuing up as opposed to doing relatively more social distancing. But if you look at where I put the red arrow in perhaps early April, if a mass testing exercise is done at that point when the number of cases is relatively lower, and it's done a few times with isolation of cases and contact tracing, I think the impact of a mass testing exercise at the red arrow would be to kind of, you put your thumb on that curve and just press it down. It might help Hong Kong to get back to zero more quickly. Now that would be in a situation where we've gone beyond herd immunity, and the virus won't spread too much anymore anyway, unless we completely relax everything. But it could go down to zero more quickly in that scenario. And I wonder if that's one of the considerations. Of course, then if we can get back to zero, we can stay at zero for a period of time with the travel measures and other measures. Maybe there's a chance to reestablish the discussions for a travel bubble between Hong Kong and mainland China, maybe other advantages as well. So I think that's something that I think maybe wasn't recognized in some of the discussions of the press conference a couple of days ago.
I did hear you last week speak to the idea that COVID may disappear in the summer. Did I hear you wrong? Is that something you really believe right now? And does weather play a big factor in that?
I certainly, viruses like COVID would prefer to spread in the winter than in the summer. For this current epidemic, if we just carry on as we're doing now, if we have the same kind of measures for the next 3 months, there'll be a peak within a month, and then the numbers will come down again to a low level. It won't disappear, but the numbers will come down to a low level anyway, naturally, because there'll be so much immunity in the population. In the rest of the world, it's difficult to say. I think for places in Europe, North America, other parts of the world that are dealing with Omicron, the numbers are going to come down and they'll be low in the summer unless there's a new variant. If there's a new variant that appears again, who knows? They could be up again. It's really difficult to predict what will happen with COVID. And remember, Delta last year did come in the summer. So I'm not going to make any predictions about the longer term. I focused on the short term right now.
Can we get your thoughts on the travel ban? One of your colleagues at HKU today mentioned the idea of eliminating the travel ban. What are your thoughts on that?
Well, we had tens of thousands of cases in the last few days with Omicron. That's the biggest threat to Hong Kong right now. I know Delta is also a threat, but it's not spreading compared to Omicron. So even if we were to allow travel back into Hong Kong starting tomorrow without quarantine at all, I don't think it would make any noticeable difference to the epidemic trajectory. The numbers of cases would be insignificant compared to what we already have in the community. But if the longer term plan is to go back to zero COVID, as I showed on the slide I just showed, perhaps in April or May, then that's a narrow window of time when the flights could reopen. You need to get, if you're going to have flights reopening, you need to build up the capacity at the airport to handle people coming in. You need other things ready as well. And if you're going to do that just for a month and then stop it again and effectively almost close the airport again, then I can understand why it might not happen. But I would certainly support the idea of relaxing travel bans, flight bans, and quarantine requirements for travelers at present.
Great. Before I let you go, with your fellow panelists, Marynia or Hao, do you have any questions for them about data and the work that they do?
No, I think we're all trying to get a handle on the situation right now in Hong Kong, and also in not only in the short term, but in the medium term, figure out how we can learn more about what's happened, how we can use all the different sources of information that are available. So I'm fascinated by their work. Right now in Hong Kong, we're dealing with a very serious situation. And I think that the next month is going to be really a difficult month for the people in Hong Kong, for our community. It's going to be tough. And we're just trying to do as much as we can to support public health efforts. Thank you.
Thank you very much, Ben. Thanks for joining. We'll let you go now.
Yeah, sorry that I need to go for another meeting. Thank you very much. Good to see all of you.
Yeah, Marynia and Hao, Bren touched on it a little bit, this idea of how localized the surge is right now in Hong Kong. And, we talked a little bit in preparing for this program about potential for global collaboration with the kinds of work that both of you are doing. Is COVID, is it so specific to local geographies that we really need to focus there? Or is there a long-term exercise and a long-term initiative that we should be focused on really joining data sources and collaborating, like Oxford is, frankly, with Tsinghua, with Hao's project. Talk a little bit about collaboration, how you're doing it today, what you'd like to see be done better. I'll start with Hao.
Okay, thanks, Mark, for your question. And yeah, as you mentioned, I think the collaboration between different areas, especially between different countries and institutions, is very important to and very significant to cope with the current situation of pandemic, especially the hit of Omicron. And I think from my experience in mainland China, if we narrowly focus on the coping with local outbreaks, we can definitely only depend on ourselves. Like if we could implement it enough early detection, early diagnosis, and early treatment of some positive cases, we could definitely not depend on any other effort to cope with the local outbreaks. But I think with the background of current international relationship and also the economy development, we cannot only depend on our local market. So in the long term, we must open our market. And like Ben mentioned before, I think in the long run, Hong Kong also needs to open the border to collaborate and let free traveling from other countries. So as long as we need to keep the market open, we must collaborate and communicate the experience to cope with Omicron. So I think it's a more like international governance problem from this perspective. So that's one point. And another point is scientific collaboration between different institutions. I noticed a question in the Q&A box, and one audience asked that if the big data is useful for developing countries to cope with the pandemic. So I think to answer this question, we need to recognize the importance of scientific collaborations between developing countries and developed countries. So maybe some experts and some expertise, specific models to help us to use this big data is also very useful for us to promote the collaboration between different countries and institutions. Yeah, that's my answer. Thank you.
Thank you. Marynia, maybe you can address that same question, if you don't mind, from a US Western perspective.
Yes, so I think that the tendency is just to focus on your local place. That's just part of human nature as well. Like there is a lot of research that demonstrates that, but that comes at a huge cost for the global community. So, like we might want to act and focus locally, but there really needs to be a much more like the science and the policy for the whole, like from a global perspective, is really transformed when we, both share resources, knowledge, ideas in a more global context. So even within the US, there's such a siloing of different approaches, and that's led to duplication of efforts. In some ways, it's, so for example, some of the things that Dr. Cowling were talking about, like that could be a whole other conversation. Like, for example, here, there's a lot of different views of if herd immunity can be reached. Like many people have gotten COVID multiple times. There's also this new challenge of long COVID, which may be a new type of illness that we haven't seen before that looks more like an autoimmune disease, right? They're like some of the summer phenomenons that we saw in the US were actually bifurcated depending on local cultures. So Phoenix actually would have higher rates in the summer because people would be indoors because it's so hot. So indoors, air conditioning, that leads to more infections, whereas other parts of the country, you tend to be outside because it's nicer. So I think that's the kind of sharing that really needs to be happening at a global level. And I mentioned this in our previous sessions, but I'm a big advocate for kind of collaboration versus competition. And so I think there was this moment at the beginning of the pandemic in 2020 where groups were willing to kind of put, the competition of who gets published first and who gets the most resources first aside. And if we really want to tackle this in a global way for future pandemics, I think that developing more infrastructures to house that will be really important, with incentives too. Yeah.
Now that's interesting how in the US, we talked about people monetizing their data. And I'm curious with how, is that being done in China? And is it being done outside of your project that you're aware of, where people are monetizing their data, selling their data to pharmaceutical companies or medical equipment companies? Are you seeing that in China?
Yeah, I think there are some collaborations between governments and some private companies to like use this testing or contact tracing data to the involvement of some private companies could help the government to better use this big data and to promote some technologies and products. As far as I know, as I mentioned, some local governments use higher use methods with higher precision of contact tracing. I think these technologies is produced by and co-developed by some local governments and companies. And another point actually I want to add to the previous question is, as I mentioned in my presentation, some local governments also show the variation of responses to the COVID-19. I think the one explanation I proposed is the self-learning of local governments, but I think there is another very important mechanism is the learning between these different provincial governments. I think that's another evidence to show the importance of collaboration between different institutions or different jurisdictions. Yeah, thank you.
I love hearing that. And we've talked about how the provinces have autonomy to address their COVID situation, correct? I don't want to put words in your mouth, but I think that's what we talked about before. Marynia, maybe you can talk about how it's done in the US, like how is data used to set policy in the US? I know it's different, but maybe you can share.
And yeah, it's different. It'll also depend on which stage of the pandemic that we've been at. A lot of times approaches have been very responsive, and what was considered high COVID or acceptable COVID or not changes sometimes week to week, sometimes month to month, or season to season. So and a lot of that is also to kind of balance economic concerns or exhaustion of resources to support different things as well. So that being said, a lot of recommendations are done at the national scale by the Center for Disease Control. So these are sometimes, mainly recommendations and guidelines, and that's kind of where we are at this stage of the pandemic. And then that is taken into account. So at the state level, there will be governors will work with their local health experts or other experts too. You might have economic folks and a lot of different groups involved to develop different guidelines for things like mask mandates, whether or not there is a state of emergency, and so on and so forth. So for example, in Illinois right now, there's a discussion of not making masks mandated anymore, because that's been a point of a lot of division in different populations, which is kind of interesting, right? We also have those recommendations are either taken into account and advocated for and or enforced or not at county levels, and then again at city levels, and then down to schools. So even within Chicago, where I am, the schools are split. So schools that are public schools, so that have government, support, still require masks. But recently, the parochial schools, so related to kind of like religious schools, they just stopped their mask mandate. Right. So there's so much. And as you can imagine, it's not, because this is an infectious disease, like if you have this patterning, of like you really need to get everybody on the same page in order to enforce COVID at a large scale. And that's been one of the reasons why you've seen this constant cycling and recycling of COVID and development of different strains and so on and so forth. Like here, and there's, like even the deer populations now, I think there's a recent analysis where a high proportion of the deer, the animals in forest that are living in forests have COVID strains. So I think that yeah, there's a big division right now, even in the science community, of how to address this. But that's, it's a scale. Like once it gets at a certain scale, it's very difficult to contain, and that causes even more challenges, right?
It's very frightening that the deer have COVID strains now.
Yeah.
And I'm sure that's the case with many other, types of animals. But Marynia, you told me that you're managing your models, your data sets in the cloud, correct?
In part. So a lot of the data is wrangled, and so it's wrangled and then it sits on the cloud, but actually when the analytics are done, they're performed in your browser. So we use kind of a hybrid. Instead of doing calculations on a cloud server, instead the data and the kind of machine of how to put it together sits in the cloud. And then when you access it using your browser or a phone or a tablet, it kind of stitches all that together within that setting. Mm-hmm.
And then how about your data sets? Are they in the cloud as well? And do you have a thin client that's doing the analytics and the graphs and charts and things like that?
Yeah, I think the mechanism is similar, and we have a very separate team in charge of the overall data set. And as far as I know, I think I heard that Microsoft is also planning to collaborate with our team to make better use of our data, because as I mentioned, since the pandemic gets more rounds of outbreaks, we have accumulated much more data since the very beginning of outbreak. So maybe in the next step, we'll make use of more advanced technology to manage our data. Yeah.
Marynia, do we have any on the Chicago side? Do we have any corporate partners like how has Microsoft working with you to understand more about the data, expand the data sets, and try to help solve some of the world's problems in COVID with big data?
So not on this project specifically. We do some of that work on other projects, but on this project, not specifically. Because we're using, and part of that is we have a really phenomenal engineering team like within house, and we're kind of unique in that standpoint, even compared to some other similar projects in the foundation that we're funded by. But we actually do the engineering in-house. However, everything that we do is published online. So even the code for how to put the website together and all the data is all on GitHub and available for anyone else to fork in that sort of thing. Mm-hmm.
Okay. When you say your engineers, are they doing some of the algorithms that are behind the generation of the spatial sets? Is that what they're doing, or?
Yeah, well, so a couple of things. So, and actually, so our shop, the Center for Spatial Data Science, or the Center for Spatial Data Science, also the predecessor, which we still, the group still runs, is called Geoda. It's an open source spatial statistical software, and it's a series of C libraries, or I think technically C++, but it goes back decades, and a lot of the technologies and algorithms within that you can also find in proprietary software like ArcGIS. There's also Python libraries and that sort of thing. So our group has the center has managed those libraries for a while. And so this is building on like decades of work. And those libraries have been repackaged into WebAssembly that comes out of that comes out of Google, but that is so the data engineers, well, we have like one or two seniors at a time. They both do the architecture of how to connect all this together, as well as leveraging the analytic libraries that are behind it. And I should say, like in the first iteration, we had all the tools available, but that we heard from the users that was too much, right? So there is kind of a fine balance of like how much analytics is enough without it being too much to take in or require 5 PhDs to understand.
Yeah. How is yours open source? Is it something that other countries, teams in other countries can use as well? Can you speak to your architecture, how it's set up, and whether it's available, publicly available?
Yeah, in our projects, actually, our data is also available in our portal and GitHub exercise. So I think the general process in our project is we have a central portal to collect the data from our many volunteers collected in different countries, and we will do data sanitation and the data checking in a regular basis. And when we confirm the validity of our data, we will publish our data also in a regular basis. So I think all the users could get access to our data at our project website. And I think another very important to publish the data in time is as a policy database, we need also the engagement of many local authorities, especially the government. So actually we have also a separate team to provide consulting to the cabinet of UK government. And this is also an analysis team to based on our database to do some comparison and analysis and report to the cabinet office. So that's another very important reason why we need to publish our data in time, because we want other local governments could see our data in time and have more collaboration to use our data. Yeah.
Great. You know, one of the things that I promised that we would talk about on this program is future-proofing ourselves with big data for future strains of COVID, for different kind of viral outbreaks. And so I think you probably know where I'm going with the question about open source and all that. Do you see the ability of your teams to be able to collaborate across teams and across data sets? And what would it take to do that globally? Who wants to start?
Maybe you can go first. Yeah.
Sure. So I love discussions of infrastructures and so even in research, one of the biggest challenges of data infrastructures at bigger scales is not the data or the technologies, it's the people part. So people are messy and complicated. So I think that we really need people like you that have just kind of asked that question and like trying to start to connect the people into the room. And also including people who actually work with the data and the infrastructure and the architecture. I've been in a few groups or workshops of people who've tried to do this, but they're not actually the folks who work with the data directly or know the challenges. So then it becomes difficult to implement, right? So I think that yeah, I mean, the open source aspect is definitely a piece of it. And also having commonalities, like we need people in that space who really clearly identify, like, what are the commonalities? What can we agree on, right? Instead of focusing on how all the different data structures are different and they're guided by different policies. And then, not just policies, but the stage before is like, what do we value as a society? I think that's kind of the bigger project, the bigger piece that starts. It's really easy to get kind of lost in that, and also kind of, at least from the US perspective, despair a little bit. So I think we really need individuals in a global space who, are willing to kind of do the hard work of having those conversations and finding commonalities so that we can actually do the work of the data sharing, analysis, and that sort of thing.
Is there like a governing body that you think should be carrying the mantle with this global big data? Is it WHO? Is it the UN? I mean, what kind of governing body should carry this forward?
I think that, a group like, WHO or the UN would be fantastic, but I think that there's a lot of politics involved with that as well, right? And just seeing how things ran in the US, like if there's too many conflicting policies or politics, and that can get in the way of pushing things forward. But I don't know. I think that's a tough question. What do you think about this? Yeah.
Thanks for your feedback, Marynia, and I totally agree with all your thoughts on the management of the project. And specifically in response to the question Mark proposed, I think this big data is more like a public product because it cannot be provided by private companies. So when we talk about the provision of public goods, I think the public sectors must take the responsibilities, like you mentioned, the UN or other international collaboration mechanisms need to take on this responsibility. So as far as I concerned, I personally am also involved in another project in UNDP, which is aimed at the data collection of the vaccination progress and vaccination rollout plan in national level. So I think that's a good example for other international organizations to do such things to provide the big data, because it's, as I said, it's more like a public goods. So yeah, that's my answer.
That's a good answer. And I guess my hope from this program was to get Hao and Marynia and Ben to start talking about this and maybe look for ways to collaborate, if at all possible. I was encouraged that we had somebody from the Philippines government that's also interested in learning more about this. So if people are interested in being in touch with you both, is that something that you're open to, kind of expanding the conversation? Good.
Yes, sure.
Yeah.
I know you're busy. I know you have a lot on your plate, but since it's for the public good, as Hao said, I think it's really worth exploring some of these things. But so I will leave it there. I want to thank you all, including Ben, but both of you who've remained with us for an additional 15 minutes, so much for participating. It's really informative, insightful, and it's something I'm really fascinated by. So thank you for all the work that you do. I really appreciate it.
Yeah, thank you. Bye.
Our
Thank
pleasure.
you so much.
Thank you. So we have a brief poll on tonight's program for the audience on Zoom, as we have been doing the last several episodes. If you're watching us live on Facebook or YouTube, you can leave your answers in the comments section below. Make sure to follow our Facebook, Twitter, Instagram, YouTube, and the UN Campus website for more information about our upcoming programs. We have many programs going on in the March, April, and throughout the rest of the year timeframe. So I hope you're able to join us for those. Thank you so much. Good night. Stay safe in Hong Kong and around the world, and we'll see you next time.